And with that, I want to turn it to the National Viral Hepatitis Roundtable colleagues, Tina Broder, as well as Louise Vincent. Just want to, before I turn it over, do a really quick time check because we're at 4:11. We've had some great questions coming in on the chat box. So, Tina, if you and Louise could wrap this up in 9 or 10 minutes, that would be fabulous. And I'm sorry to put time pressure on you, but Tina,
Absolutely.
You want to take it away?
Thank you, Karina, and thank you for the opportunity to speak today. NVHR is a national coalition with more than 500 members ranging from volunteer-led grassroots groups to large national advocacy partners. We also build relationships with healthcare providers, state and local health departments, and other government and industry partners to work together to eliminate hepatitis B and C in the United States. Next slide. A bit about our policy priorities. We work at the state and federal levels to increase access to hepatitis B and C prevention, testing, and treatment. We include a focus on expanding access to Hep C treatment in the criminal justice system, which is particularly relevant given the criminalization of drug use. We also advocate for expanded access to syringe and harm reduction services, as well as linking people who use drugs to hepatitis screening, Hep B vaccination and treatment, and ongoing health care. We advocate for increased funding to CDC's Division of Viral Hepatitis, which currently receives an inadequate $34 million annually. We recently joined over 90 organizations in calling for an increase of $100 million in additional appropriations to allow DVH to better respond to hepatitis B and C. We work to protect Medicaid and the ACA by providing public comment and action alerts to bring attention to the importance of our healthcare safety net for those living with or at risk for hepatitis B and C. Next slide. A highlight of NVHR's policy work has been the Hepatitis C State of Medicaid Access Project in partnership with Harvard Law. We provided a comprehensive review of state Medicaid restrictions on access to Hep C treatment by looking at policies regarding liver damage, sobriety, and prescriber requirements. You can find more details, including the grades and maps, on our interactive website, stateofhepc.org. Some of the major findings. Despite the important public health potential of a cure for Hep C and the opportunity to eliminate this disease, many state Medicaid programs continue to limit access. These limitations run counter to clear guidance from CMS and the treatment guidelines of the leading medical societies. We are pleased to note that at least 16 states have lowered their restrictions in the months since the publication of our report. However, these changes have mostly come in the form of dropping disease severity requirements, and many of the restrictions related to sobriety and prescriber limitations have remained in place or improved only modestly. These restrictions are the types most likely to block progress in addressing the hidden casualties of the opioid epidemic, as they bar access to Hep C treatment for individuals who are currently or recently using drugs, and for those who reside in rural communities with less access to specialty providers. We encourage you to contact us at info@nvhr.org to join us in advocacy efforts to improve access to Hep C treatment in your state. Next slide. Switching gears now to our program department, we offer capacity building and TA to partner organizations in the community and healthcare providers working to increase routine screening and linkage to care for individuals at risk for or living with Hep C. We provide educational webinars on topics such as the success of routine Hep C screening in emergency department settings and on the recent increases in Hep C among pregnant women and infants, which have occurred in parallel to the opioid epidemic. We also convene working groups for clinicians and publish fact sheets, including a recent series highlighting the variety of Hep C-related health conditions that may occur outside the liver. We also offer mini grants to community partners working on the front lines to address Hep C in a variety of settings, including homeless services, syringe exchanges, and prisons. Next slide. Finally, I'll say a few words about one of our signature programs working to address barriers to Hep C care faced by individuals who use drugs. Our More Than Tested Cured project has worked with 3 grassroots partners to engage folks who use drugs to identify the barriers and define the solutions to improve access to Hep C care. We've worked directly with drug users to develop appropriate educational materials and worked with syringe exchange programs and local healthcare providers to better understand the barriers to Hep C care and develop the solutions to expand access. NVHR is very proud of our work to support community-driven and drug user-led solutions to Hep C, and we believe our findings will continue to have national implications. Next slide. Thank you for the opportunity to speak. It's now my pleasure to introduce Louise Vincent, Executive Director of the Urban Survivors Union in North Carolina. She'll share some more information about our work together and her organization's leadership in addressing the healthcare needs of people who use drugs. Thank you.
Hello. Thank you, Tina. My name is Louise Vincent, and I work with the Urban Survivors Union. We are a community-led group whose mission is to improve the lives of people who use drugs by ensuring respect, dignity, and human rights and social justice for our community. I'm truly grateful to be here today. Our programs are carried out by people that use drugs. We believe that people who use drugs want to be healthy and have the capacity to be healthy given the proper tools, education, as well as support and a non-stigmatizing environment. We know that people's rights and health are inextricably connected. Next slide. So we're a drug user union. We have chapters in Greensboro, North Carolina, Seattle, San Francisco, Charlotte. We're working on developing chapters in West Virginia and a number of other places, so it's very exciting. Drug user unions have about 40 years of history, mostly in Europe. And one of the cool things about drug user unions is we're positioned to be reactive, meaning when there's a strong batch of drugs out, we get the information first. We are able to disseminate that information and help people protect themselves. We're pragmatic and highly purposeful. People that are existing in the active drug scene benefit from drug user organizations. It gives people passion. They're engaged in their life. They feel part of. It's this idea of moving from a passive recipient of service to an active service provider. In the Piedmont chapter, that's the chapter that worked with NVHR on this project. You can see we passed out 435,000 syringes this year, and you can read some of our outcomes. But we also, in all of our chapters, participated in safe injection facility discussions in both Seattle and San Francisco. And we are involved in advocacy-related work, a stimulant user project, smoking as a harm reduction tool, naloxone access projects. We helped pass legislation in North Carolina for both syringe access and naloxone access. Next slide. So basically, working with NVHR on the Beyond Tested Cured project has been amazing. So one of the things that this project did was it gave us, and I call them grandparents. So NVHR really came in and was able to work with us. They included us as true partners, and all of us were small grassroots groups, peer-led, and they were able to help us learn the tools of good public health. So logic models, logic models, Gantt charts, these type of, all of the things that are so necessary. They also did the evaluation and helped us get to national conferences and webinars. So next slide. So basically, we really try to put our money where our mouth is. We pay active drug users. We use team-based systems so that no one person has all of the information. Some people are really worried about paying active drug users, but we pay other people for doing jobs, and it's really important that we pay people for doing work. There's a lot of considerations, and we went and we found out a lot of things doing this project with NVHR. When you pay people stipends, it creates tax liability, and we need to train people. We need to let people know what's going on and help them. We don't want to harm them. We don't want to harm people. We want to help them. So we need to understand where the tax liabilities exist and what that means for people. We need to educate and have discussions about what's helpful for people and what they're able to do. Reimbursements are not always helpful for people in the community. We don't have the credit cards often, and the credit needed to check into hotels sometimes, and we can't wait months often to be reimbursed. So it's really important that we understand these things working with people that use drugs. Next slide, please. Sorry about that. Okay, so in order to end the opioid epidemic and all of the and reduce the harms that are associated with this epidemic, we need to make sure adequate funding should be allocated to the groups led by people who use drugs. And this next one, outside organizations should partner with organizations led by people who use drugs. So that's exactly what NVHR did with this project. They worked with people that couldn't have gotten that funding possibly and helped us learn how to be good grantees and helped us learn how to participate and be in this process. Representative from organizations of people who use drugs, we need to be members of national and coordinating bodies. So, and we need to address stigma at every level. We need to educate and raise awareness. And when we see it, we need to help people use culturally sensitive language and strategies. And this is one of the main things that drug user unions can do. We can come in and we can do these trainings. We just got through doing a training in West Virginia. We are people that use drugs that are also trained and have the tools and education that can help health departments, that can help community-based organizations practice and use more culturally competent language, learn how to interact with people that use drugs. Those are all really important pieces to this. Next slide. And then just remembering that people that use drugs need to be involved at every level of health programs, all the way from program design to evaluation. And like I said, being trainers and really making sure that we have low threshold centers. You know, I've visited a lot of syringe exchanges across the United States, and one of the things that strikes me in many of them is what it takes to get in that door. And sometimes we have got way too much sitting there. You know, the jump is way too far. And just remember to support local and national drug user unions. I know the idea of a drug user union sounds strange to people, and some people really don't understand it. So if we could talk and share about the importance of drug user-led networks and really remind people that use drugs need to be treated like human beings. We are people, and we need respect, and we need to be treated with dignity, and we will never be able to improve our health without these things. Thank you.
Louise, thank you so much for sharing your important work on the ground with people who use drugs. I really want to just express my appreciation for your perspective and for just sharing, because I think that work is so important. And thank you also, Tina, and to all the other panelists.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.